everyone, and welcome to our discussion on challenging conversations using Zoom to create safer spaces. I'm Terry Charwa, and with me is my co-instructor, Ellie Leone. So just as an introduction to our course and where this happened, this course was brand new this year. It was in our new curriculum, and this was the first class who went through this course. So we had an opportunity to build it knowing it would be delivered virtually, which we haven't done with our other courses. It's the last course in a series of 6 courses called Practice Skills. And these courses are where pharmacy students really practice the skills needed to be a pharmacist. So we focus on communicating with patients, other healthcare professionals, identifying medication-related problems, making recommendations for drug therapy, counseling patients, and so on. These courses are considered hands-on learning, and teaching is generally done in small groups with a focus on active learning. And these courses occur in what we call our practice skills lab. So what does that normally look like in real life? So I just wanted to show you a couple pictures of that. This is an example of our small interview rooms where our students can interact with standardized patients. They can counsel these patients, they can perform physical exam, etc. And in this picture, you can see 2 students are practicing measuring blood pressures together, obviously pre-COVID. The next slide, this is actually from this year with this class, and this is when we came back to campus to do in-person injection training. And these are our larger group pods where students usually work together to discuss cases and issues with the help from a pharmacist who floats from pod to pod. And this is likely where we would have done these difficult conversation discussions if this course was done in person. With all of this in mind, we wanted to create some activities around issues that were raised from preceptors who work with our students in the 4th year of the program, and also from students who'd completed the program and reflecting on what they felt was missing from their education. So Ellie and I were challenged with how to include these topics in the course for our 3rd year students who were in their final year of in-person learning before spending their entire 4th year on placements. So students do receive theoretical and background content on topics such as inclusivity, diversity, death and dying, and the social constructs around these topics. However, there's no discussion of these concepts further in small groups or actually applying this knowledge to patient cases, and students felt they needed more time to discuss these issues. We had time in our new course to allow students to use active learning to discuss these topics and to apply that learning. We also felt, given everything that's happened in the last year with movements such as Black Lives Matter and our experiences with COVID and death and dying, that we were in a position where we had to better prepare students for how these social movements and life events may impact them in their future workplaces. We felt that our course was the perfect place to have these discussions with students. We had a lot of contact hours with 3-hour labs. Their level of knowledge and experience was quite high, and they were bringing experience with them from previous work or previous courses, and they had the ability to apply these skills before going out on their 4th year of placements. As mentioned on this slide, we really wanted to ensure that the students were comfortable in any community environment they might go into in their 4th year placements and be able to care for all of the patients they come into contact with. With that, I'll hand it over to Ellie.
Thanks, Terry. So now we want to just kind of give you a brief overview as to how the situation played out with these particular labs. So in terms of the learning platform, Terry did show that we ideally would have been in person in those small group pod settings. So that was not the case this year, given that we were in our virtual teaching environment. So we brainstormed some ways to carry out this lab, and we decided that using Zoom and Google Meets, we had large group settings, and then we broke down into smaller breakout rooms. That way, we were allowed to have the facilitator pop in from each breakout room, moving from room to room, and checking in to see how the conversations were flowing, as well as provide any assistance or to navigate complications that came up if there were some students that were needing some help. And then we even had an individual breakout room where we could bring individual students that were maybe perhaps in distress or wanted to have private conversations conversations, they were able to carry those out in more of a private setting. We did have large group settings where we would kind of go from one large group, maybe half an hour to an hour, and then we would break into the smaller groups. And then some of them went back into the large groups for more of a final debrief session. In the discussion-based learning, we really wanted to have free discussion between the students. There were some guided questions that they were given as topics to discuss, but there was lots of time for these students, more than ample amount of time to decide what they wanted to do in terms of talking about these difficult conversations. We're allowing the facilitators to pop in, ask some questions, check in, see where people are at. So, what were we going to cover in these topics? We had been given the task with curriculum to cover some very complex, complicated, and ultimately challenging topics that Terry and I had to do a lot of learning in. And the students were more than capable of covering these topics, but how we found it would be best suited was in the Zoom platform to be able to give the students the idea of having some anonymous ability to kind of hide when they felt uncertain, but then to be able to come back as a team and provide that group response where they felt comfortable. The topics that we had been given included the three that you see on the screen. So firstly, we covered diversity and inclusivity. We wanted to talk about how in the workplace did we see situations through examples arise where we wanted to de-escalate situations surrounding things such as racism. We discussed how cultural contexts can have an impact on a patient's understanding of their health and their choices, and how that healthcare provider needs to have that understanding about how to integrate and deal with many cultural backgrounds. As well as come up with different communication strategies and how we can appropriately address these concerns. The second topic, which was a very heavy topic for many, included death and dying. And so we had several pharmacists come in and give their experience on death and dying. And where we really wanted students to come out with the learning objective was to be able to understand what our role is in this situation in terms of providing care to a patient and the patient's family members, for that matter, and finding ways to be able to control our emotions while still providing care in those patients that are at end of care life. And so that would be the palliative patients, but also those that maybe had died unexpectedly. And how can pharmacists be able to internalize those emotions and move forward from that as a learning and growth opportunity. The last situation that we wanted to talk about that came later on in the semester was inclusivity and trans care for patients. And actually it encompassed anyone that falls under the LGBTQIA2+ category. We really focused on that gender unicorn and really embracing the students to try to learn and engage more. So we wanted to talk about how we try to be more inclusive in our healthcare provided to patients in the pharmacy setting, what types of languages to use, and strategies to help implement that care to make sure that it is inclusive and everyone patient feels that they were cared for in an appropriate manner, and making a safer space, as Terry recommended. So the rationale for our approach. The postmodern approach was really what was the telltale way of how we wanted this to go about. So we wanted to relinquish control that we would be telling the students what to do and actually give back to the students some of that power where they could decide where the conversation was going to flow, what were they wanting to talk about, what really resonated with them. And that allowed for those small group safer settings. They were able to talk about what really impacted them, what types of past experiences they have seen in terms of their own experiences, maybe within a family setting, in a pharmacy setting, something that they've had as themselves as a patient, or what they've seen on perhaps practicum in work experiences. And it was hard, but we had to make sure that we were always thinking, we are not the experts. We all have past experiences, and we acknowledge that a lot of the students did come with a lot of experience that they would like to share, knowing though that we're always learning, we're always growing, and there's always people that we can help bring in to help guide these conversations was really important for us to try to carry out. So in terms of assessment, we did have assessments associated with each of these particular labs. So there were the 3 labs across the semester. They were all spaced about a couple of weeks apart, which I think was really nice because it gave the students some time to kind of decompress from each lab before another heavy topic conversation came about. So in terms of the assessments, they were very reflection focused, and they were individual assignments that the students had time to complete. It was almost about a week out that they were able to reflect and really resonate with what stood out from the individual labs themselves. So with the racism lab, it was an open reflection, basically a what, so what, now what. So how did you feel? What are you going to do about it? And what are your next steps? The death and dying lab, it was anonymous reflection based on the Brookfield critical incident approach. They really found that in this particular lab, they were able to self-select their groups and choose who they wanted to be with. And I felt reading those reflections, it really came out that meant a lot to them. And there was a lot of interesting topics that came out and things that were very moving for me to read. And I could tell that the students definitely felt like they learned a lot listening to these professionals that we had brought in explain their experiences and how they might be able to handle those emotions when they are faced with them in their future practice. And then lastly, the inclusive care lab, talking about gender diversity, we had them write a diversity statement, and it could have been based on any of the 3 labs, for that matter, racism, death and dying, or inclusive care. The students were able to choose one of those topics that they really wanted to delve deeper in. And then they were writing a diversity statement of something that they could actually present to a future workplace in a way to try to engage them to think about how they could institute diversity in the workforce in their future. So keys to success. Prepare, prepare, prepare. We did a lot of preparation. There was a lot of learning. We attended conferences. We did readings, CTL courses, many conferences for that matter. Many meetings went between Terry, myself, and the experts that we brought in. And there's still never enough preparation that could be done. And we're constantly going to be making changes, which Terry will talk to. We connected with experts or who we felt would be best suited to help guide us in these conversations. So individuals that have dealt directly with death and dying. So maybe somebody that works in a palliative situation. We had pharmacists that carry out MAID. We had even students that were able to resonate with other students that had maybe been on a 4th year practicum. And so they have that connection. They know what the students are going through. We have a student that is now a pharmacist who works in a gender inclusive pharmacy, who is a wealth of knowledge for us and was able to help guide our conversation. We acknowledge that everyone has positions, but we are open to learning and to acceptance and to think about the other viewpoints as well, and respect everyone's opinions and choices, and making it that safer environment, and to be open to learning. You know, we're always growing, we're always learning. I myself, I know I still have lots to learn when it comes to these types of topics, but it's just that willingness to want to better the experience for our students and for our own personal practice, which was very inspiring for Terry and myself. So, student feedback. The students were choosing their own groups, which I touched on, super key. They felt that it was very important that they had a safe space with people that they knew, whether it was people with like-minded opinions and positions, or people that they just felt that they could talk to, debate with, and felt that they could be safe in terms of expressing their opinions based on these really, really sensitive subjects. Like I said, bringing in guest lecturers was extremely valuable. The students really appreciated having people that work specifically in those conversations. We want to, as Terry's mentioned here in the slide, to bring in perhaps an expert more in the first lab. For this one, it was a lot more student focused and we didn't have that health expert. So that's something that we can look forward to. Students said, thank you for being vulnerable with us and learning aside us. So we were very honest in letting them know that this was something new for us. This platform was new, but the content was also something that is shifting. And Terry's mentioned, with the Black Lives Matter movement, like things are coming and we need to keep moving on and learning alongside these students. And I think the vulnerability of being honest and letting them know that we're all learning as a team, they really appreciated that. It was probably the most well-received teaching of the semester from the students in terms of our course content. They really appreciated those 3 particular labs, and we couldn't have been happy with their feedback.
Thanks, Ellie. So what are we going to do for 2020? So most of our practice skills courses will go back to primarily in-person teaching, given that it's so hands-on. However, we're going to keep these Zoom workshops as virtual for 2022 based on the fact that students felt this really allowed them to feel safe. They could turn off their camera, be anonymous, they could leave, they could come back in, and we didn't know. Whereas in a lab setting, that's all known to not just us, but the other students in the class. So it was just easier to manage that confidentiality in these settings. We are going to keep the same topics and still have them pick their own groups. And the biggest change that Ellie had mentioned was bringing in practitioners to talk about racism in practice. So how they've managed that in their own practice and how they've dealt with that with their patient population. So that's the biggest change we have planned, but we will definitely be using Zoom again for the reasons we've specified. So thank you very much for listening to us and our experiences. And we are happy to answer any questions live. Thank you.